And welcome back as we continue on. I'm starting to like that rapid fire segment.
Yeah, you're starting to like that now?
I mean, your questions got to get a little better. But
I'm working at it.
Yeah, not hard enough, evidently. But let's move on, shall we?
I hope you get sleep apnea.
Yeah, right. You wouldn't wish that on me, would you? Well, if I do, today's a good day for me to get it because Dr. Grant from Iowa Sleep Disorder Center, iowasleep.com is here. And Dr. Grant, good to see you.
Good to see you. Glad to be back.
Absolutely good to have you. What do you think of Brinson? I mean, I know it's early.
I like this guy.
Do you already?
I like
huh?
him. Yeah,
right.
Got a good energy.
He does have a good energy.
He looks smart too.
Well, I wouldn't go that far.
Keep drinking, Doc. Keep drinking.
All right.
I've got him fooled.
You know what? Speaking of fooled, kind of fooled, I think people are. Let's explain your clinic a little bit because you guys aren't attached to a hospital. I mean, you've got an office in Ankeny. I've seen it right on Delaware, almost at Delaware and First behind the. Is it a Come and Go? Whatever it is, it's you can't miss it. A terrific office in West Des Moines, but you guys are kind of standalone. Not kind of standalone. You are a standalone.
Yeah, we have 2 office locations, one in West Des Moines, one in Ankeny, right off the highway, very easy to get to, very easy to find. We're what we consider to be an independent diagnostic and testing facility. We are not associated with a hospital. We're independent, and I think that gives us greater flexibility in allowing patients from across the state, river to river, to come be referred to our organization, to get care and treatment at our clinic.
And as we've talked about before, insurance in most cases covers this procedures.
Correct. In fact, health insurance companies are somewhat enthusiastic to cover sleep services due to the tangent or touch points off of obstructive sleep apnea with heart and lung disease, high blood pressure, diabetes, as well as obesity.
You know, I've seen a lot of tweets. Kelsey from your office does a terrific job of, and we follow Iowa Sleep Disorders, the Iowa Sleep Center on Twitter. And I've seen a lot about kids lately, Dr. Grant, and it's an area that I don't think you and I, or when Matt was here, we ever discussed was children, but why wouldn't? I mean, I'm guessing kids get it too, right?
Yeah, kids get it, and unfortunately, unlike adults, when kids are sleepy, they don't really present with the fatigue and tiredness that adults do. In fact, they get a little bit hyper-energized and disinhibited. In fact, part of the workup now for attention deficit hyperactivity disorder in children is ruling out a sleep disorder, whether that be obstructive sleep apnea, insufficient sleep, or circadian rhythm problems that children can have.
How do you? I was just going to ask him. I said, how do you know if your kid has it? How do you pick up on that?
Well, more often than not, people will come in and start with a consult. At Iowa Sleep, we meet with our patients first. We kind of get an understanding of where people are coming from, what the problem is, and then determine testing from there. You ask the question, how do you determine what's going on? Most of my pediatric patients have insufficient sleep for what we call poor sleep hygiene or problems with sleep time and children's anxiety about sleep. Much of it is behavioral, but there's clearly a portion of kids out there that do have sleep disorder breathing, obstructive sleep apnea. Generally, though, if you look close enough, they've got some telltale signs that point you in that direction, a history of chronic prominent sore throats, large tonsils and adenoids. The other thing is snoring. Children should not snore. A lot of parents think it's kind of cute. Oh, my 3 or 4-year-old snores. Kids should not snore. If your child is snoring, that warrants an evaluation from a sleep disorder center.
That's good stuff. So will you do this, what you would do with an adult? You would bring them in and keep them overnight? I'm guessing if it's a pediatric patient, mom or dad will be there with them, correct?
Absolutely. Technically, by the letter of the law, if you're under 18, you need to have a legal guardian or an adult there with you for the procedure. But we take care of children down to age 3. I think our clinic is well equipped and set up to deal with the pediatric population. We have a fair number of pediatric patients that we do take care of and some referrals from pediatricians in the community.
Interesting. Well, iowasleep.com, and I know, Jim, go ahead.
I had another question relating to the kids. You know, you say, okay, we're going to take you to the doctor. Well, kids don't like doctors.
Yeah.
How do you?
They like this doctor. I mean,
well, no. But my point is anytime you say that, because I don't want to go to the doctor.
Yeah.
So how do you make them comfortable? I mean, I'm sure that kids are skittish if they come in.
Yeah. Well, a lot of times, my own practice. First thing you got to do is get rid of the white coat. Get rid of anything that looks like a needle.
There you go.
Yeah.
Yep.
And from there, it's actually pretty easy. I'm a parent, so I kind of understand it from
You
both ends
relate
of the
all the way,
spectrum.
yeah.
I kind of understand how kids think a little bit. It's certainly not the type of long, drawn-out consult that you'd think of with a more complex sleep patient, but it's more getting to the identified problem, whether it's the children's behavior, performance during the day, whether they're falling asleep, whether they appear to be somewhat behaviorally disinhibited, having trouble scholastically, or if they're identified as snoring.
Well, May is Sleep Better Month, and Doc, we talked a lot about the kids today. Why don't we come back on Friday and talk about us a little
Sure.
bit? Can you do that?
Sure, please. Thanks for having me.
All right, appreciate you coming in. That's Dr. Grant, the Iowa Sleep Disorder Center, iowasleep.com. For more information, as the doc said, 2 locations, West Des Moines and Ankeny. You can go online, iowasleep.com, and check them out. All right, 6 o'clock hour right around the corner. We're going to talk some NFL. We're going to talk some baseball, and we will do so right up until 7 o'clock. It's Miller and Brinson here on Des Moines Sports Station 1460 KXNO.